We hear a lot about Polycystic Ovary Syndrome, occasionally known as PCOS, but what does it actually mean? So Michael, can you explain to us exactly what PCOS is?
Well, Polycystic Ovary Syndrome is a very common condition. There are a number of features to Polycystic Ovary Syndrome, and these can include what we call reproductive features or irregular menstrual cycles. There can also be what we call metabolic features, being increased risk of type 2 diabetes and cardiovascular disease risk factors, and also psychological features where there can be an increased risk of anxiety, depression and eating disorders.
So we hear a lot about PCOS in the media these days, but how many Australian women are actually affected by it?
The prevalence in predominantly Caucasian women in Australia is between 12 and 18%, and Indigenous women it's around 21%.
And when it comes to fertility, what are the main myths that we do have to debunk when it comes to PCOS and falling pregnant?
Well, I think two that come to mind is, first of all, that having polycystic ovaries means that you have polycystic ovary syndrome. And the second one would be that having polycystic ovary syndrome means that you will go on to have infertility or difficulty conceiving, and that you will require treatments such as IVF, because even if you do require medical assistance, then fertility can usually be overcome using simple ovulation induction tablets.
So it doesn't necessarily mean infertility?
No, because in fact there are studies that have shown that women with polycystic ovary syndrome do take longer to conceive, but their lifetime fertility is not impaired.
So besides talking to a doctor, where can people go for more information on PCOS?
So as part of that, we have developed single-page patient information resources that are freely available and you can download from the website, and all the information in these resources are evidence-based and consistent with the guidelines and their recommendations. Also, the first ever evidence-based app in polycystic ovary syndrome called Ask PCOS has also been developed as part of the guidelines, and again all the information in that app is also evidence-based and consistent with the guidelines.